Everyone, today I am going to discuss the bone scapula. The scapula, it is one of the bone which forms the shoulder girdle. You can see it is flat and triangular and overlying from the 2nd to 7th ribs. Coming to the parts of the scapula, it consists of the two surfaces, that is the costal surface and the dorsal surface. Three borders, that is the medial border, lateral border and the superior border. And the three angles, that is the lateral angle, then the superior angle and the inferior angle, and three processes, that is the coracoid process, acromion process, and behind, that is the spine of the scapula. First, coming to the lateral angle of the scapula, you can see the lateral angle of the scapula, it is forming the glenoid cavity which is deepened by the fibrocartilaginous rim which is called as the glenoid labrum, and this glenoid cavity, it articulates with the head of the humerus to form the ball and socket type of shoulder joint. Then just above the glenoid cavity there is a tubercle which is called as the supraglenoid tubercle, and this supraglenoid tubercle gives origin to the long head of the biceps brachii muscle. And below the glenoid cavity there is one more tubercle. This is the infraglenoid tubercle which gives origin to the long head of the triceps brachii muscle. Next, coming to the surfaces, the costal surface, you can see this is the costal surface which is concave, and when you are holding it in the anatomical position, it should be facing forwards or anteriorly. So this costal surface is also called as the subscapular fossa, which will give origin to the subscapularis muscle. Coming to the lateral border of the scapula, which is extending from the lateral angle or the glenoid cavity to the inferior angle. This lateral border on the dorsal surface in the upper 2/3 part, it gives origin to the teres minor, whereas in the lower 1/3 part it gives origin to the teres major. Next, coming to the medial border of the scapula, medial border is extending from the superior angle to the inferior angle, and this medial border on the costal surface, it gives insertion to the serratus anterior muscle, whereas on the dorsal surface the part which is extending from the superior angle to the root of the spine of the scapula, it gives attachment to the levator scapulae muscle. Then opposite the apex of the spine of the scapula, you have the rhomboides minor, and the rest of the medial border on the dorsal surface, it gives attachment to the rhomboides major. Next, coming to the superior angle of the scapula, you can see this is the superior angle. Then extending from the superior angle towards the root of the coracoid process is the superior border of the scapula, and at the root of the coracoid process of the scapula, this superior border presents a notch which is called as the suprascapular notch, and this notch is converted into the foramen by the transverse scapular ligament, and suprascapular nerve passes through this foramen. Then near the medial part of the suprascapular notch, this superior border gives origin to the inferior belly of the omohyoid. Next, coming to the spine of the scapula, this spine, it has got an apex, a base or the lateral border, then the crest of the spine. This and the superior surface and the inferior surface. This superior surface is called as the supraspinatus fossa, which gives origin to the supraspinatus muscle, and the inferior surface which will continue with the infraspinatus fossa. Then coming to the apex, which is meeting the medial border of the scapula at the level of the T3 spine, and this is the crest of the spine of the scapula, which consists of the upper lip and the lower lip. This upper lip, as you trace laterally, you can see it is continuing with the medial border of the acromion process of the scapula. So when I hold this in the anatomical position, you can see this is the upper lip of the upper lip of the crest of the spine of the scapula, and as you trace it laterally, it is becoming continuous with the medial border of the acromion process. Then this upper lip, it gives attachment to the middle fibers of the trapezius muscle. Next, coming to the lower lip, this lower lip of the spine of the scapula, when you trace it laterally, it is becoming continuous with the lateral border of the acromion process, and it gives insertion to the posterior fibers of the deltoid muscle. Next, coming to the acromion process, this is the acromion process which has got a superior surface, inferior surface, anteromedial border and the posterolateral border. This is the posterolateral border. So the superior surface, it is subcutaneous throughout, and the inferior surface of the acromion is related to the supraspinatus tendon. Then from the tip, this is the tip of the acromion process. From the tip of the acromion process to the posterolateral angle of the coracoid process, you have got the coracoacromial ligament. Then coming to the coracoid process of the scapula, you can see it is like a bent finger. This coracoid process, it has got a vertical lower part and a horizontal upper part. This vertical lower part, in front it is related to the subscapularis muscle, and behind it is related to the supraspinatus muscle. Whereas the horizontal part, you can see it has got a anteromedial border and a posterolateral border. Tip of the coracoid process of the scapula gives origin to two muscles, that is the coracobrachialis and the short head of the biceps brachii muscle. Then along the upper surface and the adjoining anteromedial border of the coracoid process, there is the insertion of the pectoralis minor muscle, and the rest of the anteromedial border of the coracoid process will give attachment to the trapezoid part, and this is called as the conoid tubercle, which is present at the junction of the horizontal part and the vertical part, and so this gives attachment to the conoid part of the coracoclavicular ligament. Next, this is the lower lip of the spine of the scapula, which is continuing with the lateral border of the acromion process. So whole of this part will give attachment to the posterior fibers of the deltoid muscle, and this is the dorsal part of the inferior angle of the scapula, which gives origin to the few fibers of the latissimus dorsi muscle. Then this is the spinoglenoid notch, which is present between the spine of the scapula and the glenoid cavity, and through this spinoglenoid notch passes the suprascapular vessels. Next, coming to how to hold the scapula in the anatomical position is that, so you have to hold the medial border towards the medial plane, then the glenoid cavity laterally, and the spine of the scapula, which is dividing the dorsal surface into two parts, should be placed posteriorly. So this is, and the beak shaped coracoid process should be in front. So this is how you are going to hold the scapula in the anatomical position, and while you are holding, you should hold in the hand to which side it belongs. So this scapula is right side, so I am holding it in the right hand. Next, moving to the ossification. Ossification of the scapula is cartilaginous, and it ossifies from the 8 centers of ossification, in which 1 is primary and 7 are secondary. The primary centers appears for the body during the 8th week of the intrauterine life, and 2 secondary centers for the acromion process, 2 for the coracoid process, 1 for the medial border, 1 for the inferior angle, and the 1 for the lower rim of the glenoid cavity. So the secondary centers which are appearing for the coracoid process will fuse during the 15th year. The rest of the secondary centers all will appear during the puberty and fuse by 20th year of life. Thank you.